today for this information session on Minnesota's new Great Start Compensation Payment Program. This is the first information session for this new program. And I'm Deb Swenson-Klatt. I'm manager of Child Development Services, a business area at DHS that's in our Child Care Services division. And again, I'd like to welcome you to this session. We've offered similar sessions this week for licensed childcare centers and licensed family childcare providers. And this morning's session is for certified centers. And it's occurring ahead of the new program's launch in October. We held information sessions in early July on the transition grants that just concluded in September. And as with those sessions, today's WebEx is being recorded and it will be posted on the DHS website for the Compensation Support Payment Program in the coming days. We will send an email with this PowerPoint that we're using this morning for our information session, and then and that will provide you with a link to this PowerPoint and to the recorded sessions when we are able to post them. And we encourage you to visit that site soon to view the recording and the PowerPoint and for more information. Launching a brand new public program is a big undertaking, even when it's similar to a program or programs that we've previously offered to Minnesota's childcare providers. We are so thankful to the Minnesota legislature, to the governor and community leaders for their support of this program. And more importantly, we are grateful to you, Minnesota's childcare providers, our certified centers. Thank you so much for those of you who sent questions in ahead of today's information session. We have worked to incorporate responses to your questions throughout the presentation today, and including a section of our presentation that will directly address some of the common questions. And also, almost 40 childcare providers participated in engagement events with us in recent months, and we are deeply grateful for their time and the hard and good questions and great suggestions that have informed the development of this program. And finally, thank you to all of you for not only taking time out of your very busy days to learn about this new program, but also for the work you do each and every day to support your staff, the early educators in your program, in your programs, and the children and families that you serve. So before we begin, I'd like to invite some colleagues to come on camera and say hello, introduce themselves, and then we'll begin the session. Nolan.
Thanks, Deb. Good morning, everyone. My name is Nolan Fine, and I work with Deb in the Child Development Services team at DHS, and I help administer the Great Start Compensation Support Payment Program.
Jeff.
Good morning. My name is Jeff Smith. I'm a project manager within the CDS team, helping to organize and set up and get the new Great Start Compensation Support Payment Program running.
Great. And we also want to let you know that Jenny Moses, the manager of the Children's Cabinet, is listening in today. She's not able to turn on her video and say hello, but she is here as well. So with that, Jeff, can you move us to the next slide? Great. So the goals for today's information session are to first and foremost provide you with information to prepare for the first application of the new program opening this month. We'll cover an overview of the new program. We'll talk about the similarities and changes or differences between this new program and the previous stabilization base grant and transition grants, knowing that there's wide familiarity with those previous programs. So the comparing and the contrasting, we hope will be helpful to you. We'll zero in on important program requirements and then turn to those common questions that many of you forwarded to us. We'll also share information about upcoming dates and finally help you know where to go for more information and support as we move ahead. This information session, as I mentioned, is of course being conducted in WebEx, and because we have a fairly large number of participants this morning, we don't have cameras available or video available for you, and participants are muted. So we really just invite you to sit back and listen, have that cup of coffee this morning, and keep in mind that if you have questions, you can of course return to the recorded video, this PowerPoint, or contact DHS or Child Care Aware of Minnesota for assistance. So first, as we lean into the overview of the new program, we want to describe briefly the program's purpose. The Great Start Compensation Support Payment Program was signed into law in May of 2023, providing Minnesota with additional funds designed to support Minnesota's childcare industry and our early childhood educators. We think this is a nation-leading program that builds off of the Child Care Stabilization Base Grants. And the program will issue monthly payments to eligible childcare providers to fund increases in compensation and benefits for Minnesota's early childhood educators. The new program starts in October. It starts this month in just a few weeks. And the application process will be similar to the stabilization base grants and transition grants until we move the application to the new provider hub at some point in 2024. Importantly, this is a permanent new program. And although there's a little bit of a caveat there, the legislature appropriated varying levels of funding for the program over the next 4 years. Those years are the year we're in, fiscal year 2024 through 2027. And across those 4 years, the legislature appropriated this significant investment of $618.4 million. Like the stabilization base grants and the transition grants, the payment award amounts to you are determined by the number of full-time equivalent staff who regularly care for children. And this is important because because of this varying funding across these 4 years, there might be some fluctuation in the per FTE award amount made available. But also importantly, our aim is to have as little fluctuation year over year as possible in that FTE per FTE award amount. We're going to try to keep the award amounts as similar as possible across the 4 years, because we know you've told us that being able to plan for the award amounts is really important for your ability to effectively use these dollars. Also, there are many program requirements that are similar to the stabilization base grants, and there's some differences. So I'll begin to cover these similarities and differences in the next few slides. Again, because we know there's wide familiarity with the Child Care Stabilization grants, we hope this contrast of what's the same and what's different is helpful to you. So how is the new program the same as the stabilization base grants? In terms of how the program is designed, the applications will feel and be very similar to the stabilization-based grants. There will be individualized monthly applications made available to you via an email. And like the previous programs, the funding month or the funding period will be the previous month, and the hours reported in the funding period will be for that previous month. Providers must be open, operating, serving children, and in an eligible status. And of course, we say license status here, but for certified centers, we mean that you're certified. Your status as a certified center is in an eligible state, in good standing, and then the use of funds, like the previous programs, are intended to increase compensation and benefits for early educators directly caring for children. Regarding payments, like the previous program, the payment amounts are based on the number of hours reported for early childhood educators. Only the hours directly caring for children can be counted. And then another feature of the payments that carries over from the previous program to this new program is that for providers serving families receiving child care assistance or early learning scholarships, 10% increased payment is available. And of course, for certified centers, that means that that all certified centers would receive such an increase by virtue of serving CCAP children. What's different? So regarding program design, in the new program, one early childhood educator can count for up to 2 full-time equivalent staff. There is no longer a prohibition against involuntary furloughs and laying off employees. That was a condition in the old program, not the case in this new program. Also, there's no longer a requirement to maintain wages when staff are not working. And there's no longer a requirement to provide tuition or co-payment relief to families if that was possible for you in the previous program. Finally, there's some other differences that apply to a different type of childcare provider. Our legal non-licensed home-based providers in Minnesota were eligible for base grants in the previous program, but in this new program, they're receiving a very different type of payment. And then finally, there are no financial hardship grants available in the new program. With respect to children, there are some new requirements. A provider must care for a minimum number of children in order to be eligible, and providers must record and report child enrollment and daily attendance information. This will not kick in fully until mid-2024, but we do have some questions we'll be asking of providers before then regarding attendance and enrollment. And we'll be describing these more in a few minutes. What is different about the 10% increase in reporting compared to the stabilization-based grants? I sure mentioned that the 10% increased payment is available to providers who serve children receiving child care assistance, subsidies, and or early learning scholarships. But in this new program, we also have a new feature related to the increased payment. We are establishing child care access equity areas. So a program's location in an access equity area that will be determined by U.S. Census tract data on census tracts with relatively high numbers of families, with inadequate access to childcare, relatively high poverty, and unemployment rates, and low home ownership rates, and low median income. These are the characteristics of our new access equity areas, and this will be an additional factor in being able to provide this 10% increased payment to childcare providers. On the reporting front, there'll be some differences. Providers will be asked to complete an annual report describing how the funds were used after 12 months of payments. And providers must complete the market rate survey in the short term. Between October 2023 and January 24, we're requiring that the market rate survey be completed as a condition of receiving the funds. And finally, some differences for licensed and certified centers compared to the stabilization-based grants. In the new program, licensed and certified centers must use 100% of the funds to increase early childhood educator compensation and/or benefits. This is compared, of course, to the 70% requirement in the old program. There is no waiver process because of this 100% requirement to be exempt from utilizing funds for compensation and benefits. Funds must also be distributed to the early childhood educators in your program within 6 months of receipt. So the funds received in October 2023 must be expended no later than 6 months from that date. And then establishing a baseline for early childhood educator compensation will be important, and we'll talk in depth about this in a few minutes. So now I'll turn it over to Nolan to share more about these important requirements.
Thanks, Deb. As mentioned, we'll next move to the important requirements of compensation support payments. These requirements are either new or changed from child care stabilization-based grant requirements. These requirements are in the law that created the Great Start Compensation Support Payments Program and are intended to protect against fraud or misuse of funds in this new program. These measures will ensure that the program can operate long-term with public confidence that funds are being used as designed. You can see here on the slide that we'll be covering daily attendance, minimum number of children served, baseline compensation for determining increased compensation, record keeping, and the annual report. We'll start by covering daily attendance requirements. So what are the daily attendance requirements? Providers must record and report daily attendance, including a child's first and last names, date, and check-in and check-out times. Why are daily attendance requirements put in place? Their law requires that DHS establish a minimum number of children served for provider eligibility. This is an important protection against fraud and misuse of funds, ensuring that child care programs are actually in operation and caring for real children. How are daily attendance requirements being collected? Initially, attendance data requested in the application will be limited. Full daily attendance records will need to be reported to DHS once the application has moved into the provider hub, likely in mid-2024. DHS is currently developing the method by which daily attendance records will be collected. However, providers must be prepared to make daily attendance records available upon DHS's request at any time. So again, the recording of daily attendance must begin now and be made available to DHS upon request, but the reporting or submission of daily attendance will not occur until mid-2024. The October 2023 compensation support payment application will ask the following question related to your program's daily attendance. What was your program's highest attendance on a single day during September 2023? This question will remain in the compensation support payment application until the submission of daily attendance records is required, again around mid-2024. You will also be asked about your program's enrollment in a more simplified way compared to transition grants and base grant application. The question related to enrollment will be, what was your enrollment for each age group in a typical week from September 1 to September 30, 2023? And the age groups are infants, toddlers, preschool, and school age. And this can be compared to the previous format, which would ask for full-time and part-time for each of these age groups as well. But that's all been condensed into just the age groups. The law also requires that DHS establish a minimum number of children served for provider eligibility. This is an important protection against fraud and misuse of funds, ensuring that a minimum level of service was provided in return for state funding. This definition of minimum number of children for certified centers, and DHS has established different minimums for licensed centers and licensed family child care centers. But for certified centers, the minimum will be 3 children in daily attendance, with an exception of newly certified centers who've been certified within the past 6 months will have a minimum of 2 children. So again, generally it's a minimum of 3 children for certified centers, but if the center is newly certified within the last 6 months, it'll be 2 children. So to break this down a little further, the minimum of children that must be in attendance for at least 5 days during the previous month. The previous month is the funding period for the application, and importantly, yes. So again, the minimum number of children, which is 3 for certified centers, must be in attendance at least 5 days during the previous month. So again, in the October 2023 application, the question posed there will be, how many days did you care for at least 3 children on a single day from September 1 to September 30, 2023? And again, we'll be looking for a minimum of 5 days caring for at least 3 children for certified centers, unless you're a newly certified center, and then that would be 2 children. So again, the minimum number of children will be customized to your center's circumstances, whether you're newly licensed or not. And again, it'll be 3 for most programs, and then any licensed or certified within the last 6 months, it'll be 2 children. And with that, I'll hand things over to Jeff.
Thanks, Nolan. So I'm going to start by talking about baseline compensation. This is a new concept. And this is all based on the fact that child care centers need to provide information so that DHS can determine whether early educators are receiving the increased compensation over time that the program intends. Really, this is the primary purpose of the program, is to increase early childhood educator compensation. And so the law requires that those compensation and benefits be increased. And here's a quote directly from the law. It says, child care centers must use money received under this section to pay for increases in compensation, benefits, premium pay, or additional federal taxes assessed on the compensation of employees as a result of paying increased compensation or premium pay to all paid employees or independent contractors regularly caring for children. So why is this baseline concept important? Well, what is baseline compensation? At the end of the day, it's really the amount of your program's total personnel costs during the month for each application prior to receiving your first compensation support payment, and then taking out any stabilization or transition grants that were expended for personnel expenses during that month. So to put it in context of this first application in October, we're going to ask, what were your total personnel costs in September? And then what is the amount of grants that you used for personnel costs during September? And we'll dive into that in just a little bit more detail in a minute. So why is establishing this baseline important? Well, it's really to help providers meet the requirement to use 100% of the funds to increase compensation, so that you can, and DHS can, compare that baseline to future reported personnel costs, so that we can all measure, are you meeting that basic requirement or not? It should also help you in the planning for both short-term and long-term use of the funds. Obviously, understanding what that baseline is very clearly makes the planning a lot easier. And it's to support ensuring that everyone's complying with the distribution of funds to employees within the 6 months of receipt requirement that Deb mentioned earlier. So here's an example, and this gets into the math a little bit, but we wanted to make sure that we were clear about it. So in the October application, we're going to ask 2 questions. One of them we've asked every month over the stabilization base grants and the transition grants, which is total personnel costs for the previous month. And total personnel costs, as a reminder, include wages, bonuses, any benefits, whether that's health or dental, retirement benefits, professional development, etc. And then the employer portion of employment taxes. The new question we're going to ask is the second one down here. What grant funds did you distribute to early childhood educators during the month of September? And again, that could be stabilization grant funds, it could be transition grant funds. And the reason we're asking for that is so that we can take a snapshot in time. That is, what is the core compensation a provider would have given to their team if those grants didn't exist? That then can serve as a baseline going forward. And so the math is really pretty simple. The example that we've mocked up here assumes about 5 FTEs. And in this case, this provider had total personnel costs for September of $21,000. And they had distributed $3,000, which is inside of that $21,000, in grant funds during September. And so subtracting 3,000 from 21,000 gives you the baseline compensation of $18,000. Further, if we wanted to break that down by per FTE, again, this example had 5 FTEs, we'd simply divide that 18,000 by 5, and that gives us $3,600 of baseline compensation per FTE. Now, the important thing we want to stress here is we're not expecting you to do this math. You can, but we're not expecting it. All we're going to ask for in the October application is the personnel costs, which we ask every month, and the grant funds distributed. The rest of this math, DHS will calculate and help determine and communicate. So this is a brief attempt at explaining this baseline compensation. It's really to try to simplify things as much as possible. We know historically there's always been questions about, well, what am I increasing my compensation from? And this concept is really an attempt to make that a lot more clear and a lot simpler, and ensure that we're not expecting you to increase compensation above what you were doing, inclusive of the prior grant funds that you've received and distributed, but take those out in essence. So with that, let's move on to another really important requirement, and that's around record keeping. So we've talked about a few of these things already. The first one there being daily attendance records. Nolan did talk about attendance records already. Those have to be recorded every day and completed every day. The other important component is how you're using the funds. So we do expect and may ask for in the future how you are using the funds that the state has given you for this program. And then related to that, there is the expectation and the requirement that you document your early childhood educator employment, compensation, and benefits. That should include things like timesheets or other records of daily hours worked, especially in the case where you're compensating people hourly. Documentation of compensation and benefits, any written changes to employees' rate or rates of pay, and the basis thereof as a result of these payments. So that is actually a good lead into the annual report, which is also a new concept. The annual report is, as its name implies, something we're going to ask providers to do after 12 months of receiving your first compensation support payment. It's going to focus on how you spent the payment funds that you've received. Historically, in this base grant and transition grant applications, we ask you every month how you have used prior grants or are planning to use the funds that you're receiving. We're actually removing that question from the monthly application. So it's one less thing you have to do every month, and putting that in the annual report. So you just have to do it once a year. This annual report is still in development. We do not have it finalized, but as soon as we do, we will share more details with you. We're obviously going to want to make sure that we only ask for things that you have documentation for and can support. So we're going to communicate as quickly on that as we can. But given that this is something 12 months down the road, we've been focusing on the other imminent items related to getting the program up and running first. So be on the lookout for more information on that in the coming months. We'll have another webinar and tons of materials to support that, so no one should be surprised by that. All right, so now we'd like to move into some of the common questions we've received when we solicited questions from all of you and other provider types. We're clearly not going to cover every question we received. Hopefully, a lot of the material we've covered has answered the majority of people's questions. But there were some things that we received frequently enough that we thought we would call out separately. So Nolan and I are going to walk you through these. So the first question that we've gotten a number of times is, do providers need to record exact sign-in and sign-out times for children's daily attendance? And Nolan, what's the answer to that question?
Providers are expected to be as accurate as possible. DHS understands that there's a lot to manage during child drop-offs and pickups, especially for larger certified centers. However, DHS does expect sign-in and sign-out times to be accurate within reason.
Great. Another question that we certainly have gotten and expect is, what will the dollars per FTE be for the October application?
DHS is still finalizing the October 2023 per FTE award amount, but it is expected to be between $365 and $375.
And I think we'll expect to communicate that precise amount here in the next week and a half or so, certainly before the application opens, which we'll talk about in a minute. So the next question is around the payment amounts. And I think Deb alluded to this earlier, but how consistent will they be in the future?
DHS's goal is to keep the per FTE award amount consistent through October 2024 through June 2024, at which time we will reevaluate the funding amount based on program participation.
Okay, great. And I think Deb had mentioned earlier, right? We know that consistency is important for planning, but we also want to make sure we're utilizing all of the funds. So periodically we'll reassess where we're at relative to the funding and make adjustments. The next question we have received is kind of over the course of talking about the new program, people have mentioned that the new program is permanent. What exactly does that mean?
It means that the law that created the program did not establish an end date for the program. The program will continue unless future legislative action is taken to end or change the program.
Okay, that is certainly good news. And then with a lot of discussion about things like attendance tracking, will there be funding available for technology upgrades if a program would need that to make that effort easier?
Yes, there are currently 2 funding opportunities and 1 future funding opportunity that providers can take advantage of to access funds to upgrade their technology and buy new computers or iPads or anything related to their childcare business. The upcoming program is called the Child Care Provider Technology Grants. This will be administered by DHS, and more information on that will be coming soon, and we'll keep you updated. Another current source of funding is the Parent Aware Quality Improvement Grants, which is a group of grants that you can access and learn more about on Childcare Aware's website, with a few opportunities there. Another group of grants are the Regional Childcare Aware Grants. You can also learn about these grants on Childcare Aware's website. And these are, again, another source of funding that could be used for technology purposes.
Excellent. Thank you. And then we've talked a lot about attendance, but does attendance affect the award amount in any way?
No, attendance affects whether a provider is eligible for payment, but it does not affect the payment amount. Payment amounts are still based on the hours worked directly caring for children.
Right. All right, so that gets us to upcoming important dates. So the most important one being the compensation support payment application for October will open on Monday, October 16th, so a week and a half from today. Couple of changes we're making to the application. So the first one is for October, we're keeping that application open for 10 days. Before this, for base grants and for transition grants, they've historically always been open for 8 days. We're adjusting that to 10, which means the application will close on Wednesday, October 25th. One other small adjustment we're making is to the time we close the application. Typically, we've closed it at 4 p.m. We're making just a minor adjustment to make that 4:30 to just give a little bit more time. But as with anything that has a very finite window for an application period, we strongly, strongly encourage people to apply at the beginning of the application period. That avoids the risk of something coming up on the last day, significant illnesses, people being out of the office, technology problems are a lot easier to deal with when you attempt to apply at the beginning of the application period rather than leaving it to the last day. And we always regretfully have people miss out because they waited till the last minute and then something came up. So please do apply at the beginning, even though we're making it a little bit longer. The other thing that isn't changing, that we're going to stay consistent with, is that the applications will continue to open on the 15th of each month, except, as in October, when the 15th lands on a weekend or a holiday. Now, that doesn't happen very often, and we've looked at the calendar already, and it's not going to happen until May or June of next year after October. But you can mark that down on your calendar, plan on the application opening on the 15th of each month, and get in there, apply quickly, and be done, and look forward to that payment. So those are the critical, really near-term dates that we want to make sure we remind everyone of. The other really important thing is where you can go for more information. If there's anything in this presentation you want to look back at, if there's a portion of it you'd like to listen back to, we are going to be posting this presentation and then the recording when it's ready on our website for the compensation support payment program. We have literally just launched an increase of a lot of the content on these pages yesterday and today. More will be coming. So the main page was stood up yesterday, and the pages that we're creating will have similar information to what we've done in the past for base grants, but will include things like eligibility, award amounts, application periods and processes, the requirements you have to meet, the allowable uses of the funds, and then there will be a frequently asked questions section as we've typically had. I mentioned we'll post this presentation today yet is our plan. The recording will probably be about a week because there's some processing we have to do to get it ready and be able to post it. But please do frequent that website. If you have any colleagues who missed this and would like to watch it or walk through any of the information, please encourage them to go to the website. We will be sending out a message to all providers with that link to make it easy for you to find and get there. And then finally, a big thank you. Thank you for taking the time to attend. Great turnout today. We've had good turnout for the other sessions as well. As you kind of walk away from today, if there's questions, or suggestions or comments that you have, please do feel free to email us at either or both of the two email addresses here. So supportfunds@childcareawaremn.org. Childcare Aware will continue to be providing technical assistance for this program. And then the other email address to jot down is compensationsupport.dhs@state.mn.us. We do our best to get back to people as quickly as we can. Obviously, in these peak times of program startup, we're getting lots of questions, so please do be a little bit patient with us. We'll get back to you as quickly as we can with answers. But with that, I'll hand things over to Deb to close us out.
Jeff and Nolan, just adding my thanks again for your participation this morning in the info session, for listening and for staying in communication with us with questions that you might have and needs that you might have. We know that there is a lot coming at the Minnesota Child Care provider community, certified centers. You've made the transition to the provider hub already, and that in and of itself has been an adjustment. We appreciate so much your the work that you do every day and the challenges of providing this critical service. We know it's at the beginning of a school year for those of you who operate on a school year schedule, and that it is a busy, busy time. So thank you for everything you do, and we wish you a great day.